Hello, dear students. This is Dr. Neeraj Verma, Department of Zoology, PPN College, Kanpur. In this video lecture series, we shall discuss about first aid related with wounds and injuries. So, first, let us define wounds. So, as we all know, that skin is the outermost covering organ of our body. It means our body is completely surrounded by the skin, and skin act as a barrier between the internal and the external environment of the body. It protects the body from various kinds of external hazards. So, any break in the continuity of the skin and the underlying tissues can be considered as a wound. So, a wound is an injury in which the skin or another surrounding surface is torn, pierced, cut, or broken. Wounds can be external or internal in the body. External means skin wounds. In general, when we talk about external wounds, we refer it to the skin wounds or cutaneous wounds, and internal wounds are regarded to the internal organs of the body. It means if there any wound occur in the internal organ of the body, then it is considered as an internal wound. And each type of wound carries a specific risk associated with the surrounding tissue damage and infection. Now, let us see the type of wounds. First is abrasions. Uh, these wounds are superficial wounds in which the topmost layer of the skin are scraped off. It means the topmost layer of the skin is peeled off. It is something like peeling something. So these are the superficial wounds. And since they are superficial wounds, so uh, abrasions may not bleed much, but again, they are very painful. These wounds appear often when experiencing a sliding fall from a bike or from a bicycle or any other vehicle. So the wounds often contain embedded foreign particles which may result in infections. The second category of wounds is incisions. Incision wounds are caused by sharp instruments such as a knife or a razor, etc. The blood vessels show a straight cut and bleeding may be profuse in this case. So in this case, the chances of damaging of blood vessels is high. Okay, and the other structures such as tendons and nerves may be damaged too. Next is contusions. It is also called brushes. So contused wounds are caused by blows or by blunt instruments or by punching. The capillaries are ruptured by the punch and blood leaks into the tissues. Actually, contused wounds are also called close wounds. It means injury occurs without breaking the skin. Means this may be considered as a kind of internal wound. So, as we have already seen, these wounds are caused by blunt instruments or by punching. Suppose if someone punches with another person, then there is a chance of damage of internal organ, not the skin. So, severe contusion might be an indication of a deeper damage like a fracture or internal injury. And the next category of the wound is lacerations. So lacerations wounds are caused by crushing, ripping forces by machinery or clawing of animals, resulting in tears or lacerations. Actually, in case of lacerations, the wound is resulted. Uh, so in lacerations, the wound that is produced by tearing of soft body tissues, and in this case, the wound is often irregular. Actually, when you see the causes of the lacerations, it includes क्लॉइंग ऑफ एनिमल्स। सपोज कोई एनिमल है, अगर वो अपने पंजे से या क्लॉ से किसी पर्सन के ऊपर अटैक करता है, तो उससे जो वुंड क्रिएट होता है, तो दैट वुंड्स आर considered as lacerations. So obviously these wounds would be irregular in outline. So the edges are mostly irregular in shape. There is usually more underlying tissue damage. These wounds are often contaminated with germs, and the risk of infection is high. This type of wound sometimes has less bleeding, but is usually very painful. Next category of wound includes puncture wounds. So as we know, puncture means piercing something. So puncture wounds are caused by stab or sharp instruments like knives, daggers, or nails. And these wounds typically have a smaller opening, but they may reach deep into the tissues. है ना? Suppose किसी nail से किसी को wound हो जाता है ना? तो जो opening होगी that should be small, but जो nail होती है वो deeper layer में चली जाती है tissues में. So these may be very painful. Next is stab. So stab is a kind of puncture. ये भी पंचर की तरह, but it is caused by a knife or sharp blade. A gunshot wound is the wound caused by a bullet. जो gunshot wounds होते हैं, they are caused by a bullet into the body. The entry wounds of gunshot wounds are mostly small and neat, but if the bullet also exits the body, the exit wound may be large and bright. तो जो गन शॉट वुंड्स होते हैं, तो जहाँ पे ओपनिंग होती है, जहाँ पे ब्लड एंटर करती है, दैट मे बी स्मॉल और नीट, बट अगर समहाउ ब्लड बॉडी से बाहर निकल जाती है, तो जो आपकी जो ये वाली ओपनिंग होगी जहाँ से ब्लड बाहर निकलती है, दैट वुड बी लार्ज. इसी तरह से स्टैब मतलब से कोई चाकू किसी को खोप देना, समथिंग लाइक दैट, स्टैब. So next category is, I think this is amputation. Yeah, this is amputation. So amputation simply means removal of a body part. है ना, कि कोई बॉडी का कोई पार्ट उसको रिमूव कर दिया जाए, या कोई लिम्ब हो वो रिमूव हो जाए, that is known as amputation, as you can see in the picture. So amputation is the removal of a part of a limb or limb, ठीक है, by trauma or by some sharp object. And the good thing is that the reattachment of amputated limbs, fingers, or toes might be possible if the injured and the amputated part arrive at the hospital, ठीक है, as soon as possible. है ना, एक given time में अगर वो पहुंच जाता hospital, then it is possible कि amputated part को हम main body part से join कर सकते हैं. Now come to the complications of wound. So here we can see there are two complications of wound, and there are two dangers of the wound. One is bleeding and other one is infection. And bleeding is the immediate complication of wound and must be treated immediately. So you can say that bleeding is the characteristic of most of the wounds. अगर wound create होता है तो obvious सी बात है कि bleeding start हो जाती है. But let us see कि bleeding का nature क्या है. अगर small bleeding हो रही है, then you need not to worry about. But if bleeding is profuse, then it should immediately be stopped. Otherwise, अगर body से ज़्यादा blood loss हो जाएगा, then it may be fatal. अब जानते हैं कि blood is the carrier of oxygen. अगर ज़्यादा blood loss हो जाता है, तो body के जो vital organs होते हैं, उन्हें oxygen की supply नहीं हो पाती है. So in this condition, this is a fatal. This condition can be considered as a fatal. Therefore, when profuse blood loss occurs, then it is a matter of concern. Another thing is infection. So infection is caused by microorganisms. Human body is surrounded by the microorganisms. The environment in which we are living, it is full of microorganisms. So microorganisms are everywhere. Even you will be surprised to know that human body is a mixture of human cells and microorganisms. In our body, we have about 10 to the power 13 cells. So the total number of cells in a human body is around 10 to the power 13. And the number of bacteria in our body is around 10 to the power 14. So the number of bacteria is even 10 times higher than the number of human cells. No, but you need not to worry. These are the good microorganisms. They are not bad microorganisms. They are not pathogenic. So we have to concern only about those microorganisms which are pathogenic, which are considered as germs. So germs are tiny, not visible to the human eye, and organisms that can cause diseases. And germs may be bacteria, it may be virus, it may be fungi or protozoa. And infection is caused by germs getting into the body through the broken skin. जब तक स्किन कॉन्टिन्यूस है, कोई भी opportunistic pathogen जो कि वेट कर रहा है बॉडी के अंदर जाने का, it cannot enter into the body. But as soon as this barrier breaks, now the opportunistic pathogen has a chance to get enter into the body. है ना? So the germ multiply in the wound and make it infected, also called as septic. So this condition is called septic. अगर wound infected हो जाता है, then this condition is called septic. And germs may later get into the blood streams and that cause a septicemia. अगर इन्फेक्शन हाई हो जाता है वुंड में और इन्फेक्शन ब्लड में चला जाता है, ब्लड स्ट्रीम में चला जाता है, then this condition is called septicemia. And septicemia is a dangerous condition. Actually, septicemia is a stage which is called multiple infection. It is a stage of multiple infections, है ना? और इस multiple infection से prevent करने के लिए doctors prescribed broad spectrum antibiotics, but many a times broad spectrum antibiotics do not function properly, or simply they cannot remove all kind of infectious organisms. So septicemia is a very, very dangerous situation, and many a times it is a fatal situation. So the prevention of wound is very, very important. The first step consists of personal hygiene and the washing of your hands prior and after taking care of a person. ठीक है, अब अगर हम बात करेंगे फर्स्ट एड की, फर्स्ट एड रिलेटेड विद वुंड एंड इंजरीज. So the first step of the first aid is, first the person who is going to provide first aid, he himself must use personal hygiene, and this includes washing of your hands prior and after taking care of a person. Now let's see. Yeah, yes, small cuts and abrasions. So even if the injured person has a small cut or abrasions, you will still need to be take care of the wound to stop the bleeding and to prevent the infection. So bleeding and infection, these two are very important things. First you have to stop the bleeding and then do something to prevent from infection. Now, the person who is going to take care of an injured person, what he or she should inquire. So, he or she first observe that the skin of the tissue is damaged or not damaged. Then, open skin or tissue might be bleeding or not bleeding. The bleeding might be minor or profuse. The skin might be discolored or not. And the casualty of the might and the casualty might feel pain. जो person injured हुआ है, is this feeling pain or not. After that, जो person आपका take करने की first aid करने के लिए जा रहा है, first he has to wash his own hands. So for this, you can use a soap and water to wash your hands. If soap is not available, then alternatively you can use wash. Even nowadays, the alcohol-based sanitizers can be used for this purpose. So first you have to wash your own hands and then try to stop or slow down the bleeding of the injured person. So for this, you have to press on the wound with a clean cloth or bandage. If a clean cloth of cotton is available, then you can use it, or you should use a bandage. If possible, ask the injured person to cut the gaze himself. Okay, cut or gaze himself to stop the bleeding. ठीक है, जो इंजर्ड पर्सन है वो खुद से अपने आप से उसको प्रेस करे कट को या गेज को, ठीक है, with the help of bandage or cotton to stop the bleeding. And then rinse out the wound with clean water. This is very, very important. To clean the wound with to rinse out the wound with clean water. Here clean water means sterile water. The water should be free from pathogenic microorganisms. So for that purpose, we should use a sterile water. If sterile water is not available, then you can use a boiled and cooled water. यानी कि water को पहले boil कीजिए, उसके बाद उसको cool कर लीजिए, और इस cool water को now you can use an sterile water. So pour water on the wound until you cannot see any foreign material left in the wound. wound को तब तक wash करना है जब तक आपको कोई उसमें foreign material दिखाई देता रहा है. जब wound बिल्कुल clear हो जाए तभी आपको washing stop करनी है. If necessary, wash out the wound under running water. So again, this is running water. Again, this is dangerous because running water may contain microorganisms. So better to add some disinfectant in the tap water. If you are going to use tap water, you need a large amount of water to clean the wound. So it is better to add some kind of disinfectant. For example, you can add betadine in the tap water, and then you can use this water to rinse the wound. Foreign materials means dirt or anything else that comes from outside the injured persons. And here you can see the important thing is that in the event the wound is bleeding profusely, do not waste time cleaning it. Your priority is to stop the bleeding by applying pressure on the wound. ठीक है, अगर profuse bleeding हो रही है तो सबसे पहला स्टेप होगा should stop the bleeding, और bleeding stop हो जाने के बाद ही हम cleaning की process करेंगे. And for that, if you have a piece of clean cotton cloth, then cover the wound with it. Use adhesive strips to close or clean cut. If no strips are available, then you can use a bandage and bandage the dressing to the wound. And do not apply the bandage too firmly. अगर आप bandage apply करने जा रहे हैं, ठीक है, किसी injured person के wound के ऊपर, then do not apply the bandage too firmly. If the part of the body below the damage changes color, is swelling, or is feeling numb, then loosen the bandage a little bit. Now tell the injured person or the person caring for him to keep the wound dry after cleaning with water or getting more. So drying of wound is very, very important. After all these procedures, the wound must be dry. wound किसी भी condition में आपका must गीला नहीं होना चाहिए, should not be wet, because जो wet की जो condition है, it invites microorganisms to grow there. So and every 2 to 3 days the wound should be clean and the dressing changed. यानी कि हर 2 से 3 दिन के बाद the wound should be cleaned and dressing should be changed. If a dressing needs to be changed, do not tear the old one off, as this can damage the healing process. Suppose अगर आप किसी के बैंडेज को रिमूव कर रहे हैं, ओल्ड बैंडेज को, तो कई बार होता है कि जो वुंड का जो एरिया होता है वहां पे बैंडेज को स्टिक कर जाती है. तो इस कंडीशंस में आप बैंडेज को फोर्स लगा के निकालने की कोशिश मत करिए, अदरवाइज जो हीलिंग की जो प्रोसेस है दैट विल गेट डिस्टर्ब. उसमें क्या करेंगे आप थोड़ा सा स्टेराइल वाटर लेके बैंडेज के ऊपर डाल दीजिए. थोड़ी देर में जो आपकी बैंडेज होगी वो वुंड एरिया से आप बड़ी आसानी से उसको आप रिमूव कर सकते हैं. So preferably saline water available and the old dressing that it comes off easily. If the wound is infected, this is very, very important. अगर wound infected दिखाई दे रहा है तो person take care है, then allow the patient to a nearby hospital, to a nearby healthcare facility, which either it is a PSC or a district hospital, whatever, है ना, for further care. Okay, even small wounds need attention to prevent infection. So again, the emphasis is on infection, to prevent infection. Even if the injured person has received appropriate medical care, there is a need to watch out the infection. है ना, और infection आप कैसे पहचानेंगे? How will you diagnose the infection? So these are the steps. The pain that is going worse. Suppose injured person is feeling pain और ये pain बढ़ता ही चला जा रहा है. Swelling, hot or red skin around the wound. अगर wound के आसपास के skin red है, hot होती चली जा रही है, hot है, लगातार बनी हुई है ना. The wound shows discharge. अगर wound से some पस जैसा कुछ remove हो रहा है, discharge हो रहा है ना. Person having fever or feeling unwell. So these are the symptoms of infection. So in these cases, the injured should seek फर्दर मेडिकल, है ना। और फिर आप इतना प्राइमरी ट्रीटमेंट करने के बाद, फर्स्ट एड करने के बाद, फिर से अपने हैंड को वॉश करेंगे। जो भी पर्सन आपका फर्स्ट एड दे रहा है, he should wash his hand with the help of soap and water. It is not available, then alternatively you can use ash. And nowadays, alcohol-based sanitizers can be further used. Okay, so now the next topic is this is not head. Okay, head injuries, but we will deal this topic in the next lecture. Okay, so now I'm going to stop, and the further portion of this you can see in the next lecture.